Okay, this is Senate Appropriations, and we are still working on the BAA. We have Catherine Benham here with some requested language as it relates to um, uh, legislative employees and the language that is being offered for us to consider. And I'll let you take it from here. Oh, David, David, I thought you were double booked or something.
I have 15 minutes.
Oh, great.
So,
Perfect. That was perfect timing.
yeah.
All right,
Just
thank you.
literally started. Thank you. I'm Catherine Benham with the Joint Fiscal Office.
And I'm David Leonard from the Office of Legislative Counsel.
And maybe I'll just give a quick overview and then you can explain the language. This relates to legislative staff overtime and how they get compensated for overtime. And traditionally, when people have worked an hour of overtime, they've been able to have an hour of compensation time so they can take vacation in the off session and have more time off. And through some discussion this summer fall, it was found that we were not compliant with state law, and I'll let Damien walk through that. And what we're asking for is we would like to return to prior practice because comp time is important for employees. There's a provision that's affected 20 employees in the legislative branch in every office. We would like to turn essentially to prior practice, and it's a two-step process. One step will be this language, and the second step will be going to the Joint Legislative Management Committee and having them adopt a policy that addresses what compensation time, what you accrue for compensation time.
Yeah. So, to fill in a few more gaps, basically what happened this summer is a staff member asked HR a question about their pay, which triggered a question for me about what's the law on this, and we looked closely and looked at the individual's duties and realized that so the legislature is exempt or not covered by the Federal Fair Labor Standards Act, but we are covered for a small subset of employees by the state overtime requirement, which meant this individual had been receiving comp time, but we found out after looking at their job duties that they were actually supposed to be receiving time and a half overtime.
Pay.
Cash,
Yeah.
yeah. So time and a half overtime in cash rather than receiving comp time, which then that triggered a review and we identified other employees who'd also been misclassified. And then we've since gone through and fixed that. But in order to go back to the practice of giving employees the option of comp time, we actually have to change state law because otherwise we're out of compliance with state law. We don't pay cash for these employees. Some employees may want to retain cash, but if we change state law, we can then adopt a policy that allows them to opt into one or the other.
Gives choice.
Right. So Hannah, do you have the ability to just post or share? Oh, everybody's got it. Great. Perfect. Sorry, I'm so used to sharing on the screen in the house. I've just been there nonstop for the last couple of weeks. So
Well, it's nice that you could spend a little time with us, David.
I've been feeling neglected by the Senate, honestly.
We always love to have you come by.
Yeah. I've been told I'm gonna be spending a lot of time here in a couple of months when all the bills cross over. So, so what we do here is, this is the exemptions from the state's overtime law. And so we're just adding a new one for permanent employees of the Vermont General Assembly. So this means temporary session only employees will continue getting paid time and a half cash overtime, which has been the practice. But this will allow the state, allow the General Assembly to adopt policies going forward governing overtime compensation for other employees that are permanent and year round and who would have the ability to actually use comp time. You know, if you only work here from December through May, there's no time to use your comp time anyway. So this just allows us the flexibility with permanent employees.
So we do have now a joint legislative management oversight committee, and we also have a human resources division that is also involved in looking at personnel requirements. And this, that is something that you have discussed across, the different, divisions within the legislature.
Yes, all the office directors have had several discussions about this, and everybody would like employees to have this option, because it's an important it's an important benefit of the job for people who don't accrue much annually to be able to have an option to have more time.
And by the time you get done with this section, people are really in need of, need some
Yes.
rest.
No, I think it works,
So the
much
question,
flexible and good.
so the, decision for us would be to, include this, this change here in the, because we need to be making a decision very quickly.
I'll move that.
Well, we're just,
We're just putting it in.
yeah, we're not gonna take a vote as long as everybody understands why it's being asked for, and it's just adding number 8, to this
Yeah,
section of law.
and there shouldn't need to be any changes to the draft here. It just is labeled as unedited because it was just the initial draft and it hasn't been through the editing process. But you can do that as part of your
Well,
PA.
you can get
There's a lot there to edit.
I know.
number
It's-
8.
Some, I always have people who get concerned, but I always put that on there, mostly to protect me if there's a spelling error. And somebody notices it, I can say, well, nobody looked at it yet.
All right, thank you. You have this language, Grady?
Send it to.
Yep, absolutely.
Thank you.
Thank you all very much.
Thank you.
Appreciate it.
Thank you for fitting me in. So I appreciate it.
So the one thing that we miss about remote is that we got to see everybody's children, everybody's staff.
walking behind them.
Yeah.
So I always love seeing your beautiful children on the screen.
And my girl will be walking through the State House at some point this afternoon, so
Well,
here, I have to pick them up from school in about 2 hours.
well,
So maybe I'll bring them in. to
you
finish
should,
up the
you really
testimony.
should. Yeah, they could testify,
Yeah.
right, about overtime for their.
Yeah,
father.
exactly. Although they're gonna be asking for like more candy and all the committee. That's the thing. All
Well,
right.
I've got some cookies, if anybody wants cookies, there's shortbread or, chocolate ones. Oh,
I
God.
don't do that.
Look, I gotta get rid of
I'll
them.
send that to you.
I mean, that's not very nice, since I gotta get rid of it, I'm bringing it in.
I'd love some cookies. I missed, on Thursday, I missed the cookies from the judiciary, Terry Corsone's cookies in judiciary, so my gosh.
Oh, well, I'll make you something, Dick,
Okay, well, maybe Tuesday we can have something.
maybe Tuesday. I'll see what I can do.
Thank you.
My nephew ordered a chicken pie. I know.
There you go.
Okay, so now I want to move on to the certificate of needs extension request and, more- and that's something that, Senator Lyons has mentioned and Senator Westman, who has been approached by, his home health agencies. And so if you would, kind of present the language here and what we're doing.
Right, so basically, the language extends that no CON shall be granted for offering of home health services, which includes hospice, or for a new home health agency through January 1st, 2030. We've renewed this a couple of times. I'm trying to remember how many times. It went up to 220, then it went to 222, then it went to 224, and now the asking to have the extension to eliminate the CO or just not have it, have a moratorium until 2030. The reason really relates to the, difficult situation that our home health agencies are in. They're not doing well. Their profits are down. The workforce is lean. And the concern is that
With financially destabilized and more competition.
if there were more coming in, it would destabilize. It would allow for, perhaps what we call cherry picking. And would remove some of the financial benefit from the programs that we currently have. So, I would think that this would support our current home health agencies, and then we can work in other ways to make sure that they don't die financially.
All right, other comments, maybe other people have been contacted, so questions?
I would just say that from my point of view, this does not create any change in policy. They had protection
Continue.
now continually for actually decades.
It is decade. What was the first year? I was trying to find it. It was a long time
God,
ago.
a long time ago.
Yeah.
This would put it solid.
Ever since the CON was-
No.
Not ever since the CON, because we did the CON in the eighties, but it was sometime. But it's at least 20 to 25 years, I would suspect. But this does not create a new policy.
But the idea was at some point that there would be a room for open competition in the marketplace.
Well, I guess
That's why it was
that's,
a date.
That's the question.
that is the question,
2010.
2010, and this is 2024.
Well, it says 2025, cross that to go to 2030. so
We'll
that-
go to 2030.
So the question that I have, is BAA, is this the mechanism to do it? I mean, this is a question we're gonna have.
We do have a bill in our committee that we can take up and take full testimony on, if that would be preferential. My committee has not taken testimony on this. We've talked about it once or twice. It's a policy decision. I do know that House Human Services did take testimony and decided not to include it because there were one or two folks who wanted to have further testimony.
But-
But I don't know that we're gonna get any more information than what we've been getting over the past several years, and we're not changing the policy. I agree with
It's
some
not
of this.
changing policy, and if our rule is in budget adjustment that we're not gonna have new policy, this is not a new policy.
But it's a new policy, and that the policy was to end at 25 and we're ending in 2030, if that's.
Where it's
I guess it's extending that.
Yeah,
It's extending the existing policy.
But it's also not urgent, because goes through January 1st of 2020.
I guess that's my question in terms of.
no, it's not urgent,
Okay.
but it is urgent if you're a member of the home health agency group. It feels urgent.
Yeah,
They're very, they're
They're
scared.
worried.
They're scared.
Home health and VNAs or the privates?
Talking about anyone going for a new CO.
oh, well, there is a,
We have.
for-profit, there's one.
Yeah, there's one by they had cover statewide, and this would not allow for any additional.
Home health, including hospitals.
Mhm.
I think the home health community is well, not only basic, but I think within that community, there is some insecurity. And I
Okay,
If we extend this, it'll.
make them feel better.
okay. So people have, obviously, it's something that it's not new, it's just extending the protection in terms of the delivery system
Fine.
for,
If you
fine.
do it.
well, it looks like that side of the table is unanimous.
They
I
are,
think Andy was.
And they got more people on that side too. My side is not.
I know. Oh, Senator Sears. Senator Sears, do you have an opinion about extending the moratorium? So that right now we're not adding more competition in the home health area, service delivery area of healthcare.
I must say it's in deep trouble, and anything we can do to help. Yes.
Okay. All right, thank you. Well, we just added one more.
yeah, your side just turns.
Okay, I'm going along with my team.
Going along to get along, as they say.
Yeah.
All
Well,
right.
I do want to add my personal experience with the home health. The only difficult part, well, there's a lot of difficult parts, but one of the challenges was getting people to come on a regular basis. They're having a hard time recruiting people in any.
Huge.
It's been, it was an eye opener, and even in the hospice area as well was difficult. So
Which is included.
Okay, well, yes, and you've had a very recent experience with that too. So I think the consensus is to add this language, which Grady has. Now we're down to a small addition on dams.
Yep, the 165,000 that is in for the completion of the dam study for Green River Reservoir. I had a request from Morrisville Water and Light that presently owns the dam, that when the study gets done, that the study is shared with them. I took it up with Julie Moore, the secretary, and she said she had no problem adding that language. She said it was her intention to let them have the study anyways. And if they would feel more comfortable with a language saying that when the study is done, they get to see the study, she would have no problem with that. So I asked Grady to draft up a single line doing.
Okay, come on up, Grady.
Grady Nixon, Joint Fiscal Office. So the language addition will be in section 42 of the budget adjustment. This amends section B 1103 of Act 78. The language addition will appear in sub N.
It's not good. I've clicked mine shut. All right, where am I again? 40? What'd you say, section 40?
Section 42.
Yes. All right, so starting with line 18 is the to complete the engineering assessment. So you would do what?
So the addition will read, following Dan, the department shall share the findings of the assessment with Morrisville Water and Light.
Is there a reason to limit the Morse?
I
They're
think
the owners, right?
I know that, but I didn't know if that means it's not a public document.
If you want to make it a public document, that would be fine. As far as I'm concerned, I only addressed with the secretary that it was the concern of Morrisville Water and Light as the owner of the dam. And she said she had no problem with it. I'm happy to go back and ask her if making the whole thing public to everybody, but I only agreed to what I asked specifically of the secretary.
Although I imagine under public record.
And I was gonna say.
Absolutely, I think that's probably the case. And
But
I
they
think-
want assurances that the assessment, as the owner. So the department shall share the assessment with Morrisville Water and Light Company or whatever they are.
They're technically a department, but they refer to themselves as simply Morrisville Water and Light.
Okay,
So that won't be reflected in the language.
all right, well, I think it's probably. It's comforting, but probably gratuitous.
Yes,
Gratuitous comfort.
All right.
While I am in the seat, I would like to clarify, I heard from the treasurer's office regarding the cryptocurrency language.
Yes. Oh, thank you.
The timer for remittance is covered in a different section statute. In Title 27, Chapter 18, Section 1461, sub 13, property not specified in this section or section 1462, 1463 through 1467 of this title, the earlier 3 years after the owner first has the right to demand the property or the obligation to pay or distribute the property arises, shall be presumed abandoned. So the earlier of those two is when that would be triggered. So the language doesn't have that time frame in it in the bill. Because it's covered by a different section of statute.
So the concern that was raised yesterday was, a long period of time between when it might be reported to when it's liquidated. So the reference you had specifies a period of time after you report it, that it has to be liquidated.
Correct, so,
Just read the part that says you report it on December 1st and you have X amount of time to liquidate. And then you have a specified period of time to remit.
right, so,
What was the section in there? Just this one. It's in the back.
What page, I think that.
That was near the back.
I have a question. I suspect some people might be thinking we're gonna be talking about, after school programs. Or not. If you are thinking we are, that's not on the agenda for today. So
What section?
I don't
section
know
87.
Oh, thank you.
where that, and I was looking at some other people in the room and thinking that, somehow there was an impression that we might be having a discussion around, how we, take the funding that we have, generated from the cannabis tax, but we're not gonna do that. So, I imagine you want to go back to,
Yeah.
your afternoon committee. Okay. What was the section again, Brady? I'm sorry.
Page 87.
Page 7.
Page 70. Oh, I'm just close. Okay. All right. So the treasurer believes that existing language, I can see we've cleaned out the building. You're not interested in cryptocurrency and remittance? Apparently not. I don't blame you.
Yeah, the concern was that it's at any time within 30 days prior to the remittance.
But it didn't put a time frame on when you had to liquidate, so you could report it and wait 10 years to liquidate.
Yeah.
So, it is reported and presumed abandoned, the earlier of 3 years after the owner first has a right to demand the property or the obligation to pay or distribute the property arises. So, it's a 3-year, after that 3-year period, it's considered abandoned property and then this process begins.
So the liquidation shall occur within 30 days prior to the remittance. The remittance is what? What is the?
The cash that they.
The remittance to the unclaimed property fund. So,
So when the bank sends it to the unclaimed property fund, that's the remittance.
correct, so, it is considered abandoned property and then it must be remitted. And this is either 3 years after the owner first has a right to claim it.
But then, let's say a bank is holding it, they have 30 days, they have to say, we're gonna remit it on June 30th, so we have to liquidate it on May 30th, because we have to meet this 30 days prior to remittance.
Right, so, 3 years after the owner of the property has a right to demand it,
Right.
the process begins, so they would 30 days prior to that liquidate it.
Okay, so,
Within, so it could be,
so there's already a
Yeah.
time frame from when it's reported, they've got 3 years to claim it before it can be even considered abandoned property. And then at that point, it's liquidated, like they have a process, stocks have to be liquidated, I think the testimony was.
Right.
So, in essence, the treasurer's office feels that the timeline, we don't need to worry about
Right,
reporting and setting a timeline for that.
correct.
All right, so we can close that out.
I had misread it earlier and didn't see shall liquidate, so I was thinking, what happens if you don't have a password? But I'm good.
Oh,
that is a problem,
Password.
that is a problem with the crypto.
It is a huge problem with crypto.
yeah, I don't know how, well, there must be something to,
How can you,
No, if you lost the password, you lost the money.
have you? Oh,
Yeah, I
really?
believe
Oh,
that there's actually the one person that supposedly has
Yeah.
over 100 billion in Bitcoin cannot access it.
You've got one more chance, isn't that right?
Yeah,
I was
I think
reading
so,
it.
yeah.
But he can't remember his password.
Or we lost the computer or
Lost
something.
it. All of a
Um,
sudden.
And this language actually, the last section of that addresses that, so. If it is identified as non-freely transferable, the holder is not required to still live there.
Okay, so they've anticipated that possibility.
Correct.
So we can thank you for following up on that, appreciate it. Anything else that you had?
I believe that's all I have for now.
We have the president coming in at 1:30, and then we can come back for a period of time. Maybe have a little bit more discussion. On some pieces in the meeting. I was thinking primarily about understanding and reviewing the FEMA match. We've got the 10 million that is in there, plus that 5 million ARPA, which is, I think we got weren't clear on what that money was for, but our hope is to make it clear today. Happy done. And I think we'd call it an afternoon. And then we'll decide where we go from here. Well, welcome, President Paramount. Yeah, good to see you. Where did Wendy go?
I'm right here.
Oh, there you
Hi.
are, hiding in the corner. Anybody want to see you again? You want a piece of fruitcake?
Sure. That was up from last week.
Yeah, it was
It gets
from a
better.
couple days ago.
Last Christmas.
Yeah, last
I
year.
think that's appropriate. Let Bobby eat cake.
Well, welcome. I know that you were probably doing a number of committees today. We
He doesn't say that at all.
because it's the last one, right?
No, we have Senate education after this.
Oh, you do? Okay, all right. Well, we might not be last, but.
Goes without saying.
Well, welcome, so.
We're not being recorded or we are, okay.
Oh, yes, UVM alum is up there remote and Senator Sears.
Oh, yes, hello,
Oh,
Senator
hi,
Sears.
Senator Sears.
Yes, hello,
Good
Senator
afternoon, Mr. President.
He had surgery yesterday, so but,
I'm recuperating in my Patriots hat.
Nice.
It looks fantastic, yeah.
all right, in time for sports betting, right?
Oh my gosh.
I hope you participated here. Okay. We have a document here, but we'll let you sort of give us an update on what's happening, at the university and, opportunity to, give you a chance to brief us and give us information, and people can ask you questions.
Thank you.
It's all yours.
Yeah, always good to be here, Senator Fischel, and with all of you. This is all, I'm happy to be interrupted anytime, please ask away. As I normally do, I bring a one pager, so I'm not gonna lead you through every number on there to take a look, but as usual, I'm most proud of the fact that the University of Vermont adds about 1,100 or so people to the workforce of the state every year, right? So about 1,100 of our students who graduate stay in the state and work. And that includes a good number of out-of-state students who come and add to our workforce, which they're highly trained, and so about 95% of our students get jobs or go on to graduate school right away. So the result, if you will, of going to UVM is very positive. The ROI is very good. As you probably know, one of the things I've always talked about is affordability and access and how frozen tuition for 5 years in a row. But our board also just approved our freezing tuition for in-state Vermonters for a 6th year. So it'll stay flat again for another year. Moreover, last year we introduced a program called UVM Promise on our own that said that any family making $60,000 or less could send their kids to UVM paying no tuition at all. At that time, the median income in Vermont was about 62,000. So we were covering about half the families. The median income went up by quite a bit. I don't know if it's a blip or what, but so we
No,
wanted
actually
to,
wages, nationwide have
yeah,
seen the gain.
yeah. So it's, I mean, when I last year it was 72,000 or something. So we changed our threshold to 75,000, which captures more than half the households in Vermont. Again, any family making 75,000 or less can send their children to UVM.
Not any family, only the ones that get it.
Yeah, most of them get it. You know, it's not,
What is the ratio for
Oh, the
the
acceptance
Vermonters
rate?
that apply that?
it's a very high acceptance rate. If the Vermonters have reasonable GPAs and scores and stuff, of course, the top students get the green and gold scholarship and I can give you the admission rate for Vermonters.
Yeah, it would be good to
It's
know.
much higher than for out of state students.
Right.
So
But I didn't know if it was like 55% or 95%.
So I know what it is.
Yeah.
Are
It's
you want to put yourself on record?
Sure, I am Wendy Koenig with the University of.
You're welcome to come around out of the corner, when.
68%.
68%.
yeah, I thought 70 was the right number in my mind. So that's a good number. right?
And what's the ratio of male to female now?
That's a good question.
That is a good point. So I think I expressed to you with some alarm that it had, our incoming class had gone down quite a bit to like 69-31 or something like that. Each year we've been ticking back up. And so this year it's more like 63-37 or so. The national average is 60-40. So I want to get to the national average if we can, not, you know.
We're talking about male to female,
But, yeah.
that's sort of the.
Yeah, yeah. So the exciting thing is, because of our COVID performance, because of the pros and tuition, the promise, et cetera, you know, the interest in UVM is at an all-time high. There've been, you know, there's about 30,000 applications for the 3,000 slots. And so we get to construct a class of the kind we want. More BIPOC students this year than ever before, or first-gen students. And more Vermonters. So we've had an uptick. We have more Vermonters this year admitted than and enrolled than the last 3 years. So, and remember, this comes in the face of the number of students available dropping rapidly. 2010, we had about 7,200 high school graduates graduating from high school. 2020, it's like 5,100. So, you know, massive drop of 2,000. And yet the numbers at UVM have been pretty flat, which means as a percentage of the graduating students, it's going up. And now, would I wish we had more? Yes, but there isn't the supply. But our hope and goal is to be as good a bet for Vermont students as we can. And that's where the affordability, almost half of them pay nothing to go to UVM, and the UVM promise is helping.
Well, the average debt, it's impressive, only under 15,000.
Yeah, that average is very low, so, yeah.
That's undergraduate,
Yeah.
not medical
That's
school.
Right, well, they'll make more money afterwards, that's okay, so.
I like that.
Well,
Engineers and whatever, okay.
and so, I mean, there's other facts here that you can look through, and certainly happy to answer any questions about that. But really what I was hoping to share with you today is my sense, and an increasing sense in our community, among our alumni in the country, about how UVM used to be, I think, a regional school that attracted students from Connecticut and Boston and, you know, places in New England. And today it's truly become a national school, an international school. We have a lot of applications and interest from Chicago and from Washington State and California and Texas and Hawaii and all that. Over 50% of our students for the last 3 years that have been coming in have been outside of New England, right? And that's very, very important for future sustainability, because the number of high school graduates, not only in Vermont is dropping, but in New England is dropping, right? So if we just kept relying on them, our feedstock, if you will, would be just smaller and smaller. And that's what, the universities in New England are facing. Maine and New Hampshire, you hear horror stories about what's happening at Penn State and their cuts in New Hampshire, et cetera, et cetera.
West Virginia.
So,
West Virginia.
yeah, West Virginia, that was started, that was.
Oh, that was a
yeah,
massive
Right,
uh,
right,
reduction in faculty.
yeah,
One of the things when you're talking about out of state or out of country, when Senator Westman and I went to Taiwan, they're very interested in working out, academic exchanges. And of course, if you want to learn to speak Mandarin Chinese, they have wonderful schools, but they're one of our major trade partners, particularly in, the semiconductor area. And so, don't know to what extent there's been any discussion, but they're very anxious to establish not only trade, but academic, relationships with the state, and understandably, because they're not recognized, and that whole relationship with mainland China. So, it just triggered the thought, the extent to which we might, have some discussion, and they have an office in Boston, that could really help facilitate any discussion
Yeah.
around,
Senator Kitchell, Taiwan is an amazing country. I know it really, really, really well. Several of the universities there were set up. I used to Purdue University, as you probably know.
well, then you can just take it from
It's all
here.
Purdue, right? They
Yeah.
actually have that out there. When I came here, one of the goals was to sort of grow our international population a little bit because of the diversity that it adds and such. COVID hit, we weren't able to do it. But our international applications are ticking up very quickly. But if there's a particular connection you've made with someone, please pass that on. We'll pick it up from there, and we would love to work with Taiwan. Taiwan is also has the advantage of not being China. So it is such an easy country and a good country to work with that we would love to do that.
And they have a huge relationship here because of the semiconductor.
Right.
business.
Yes.
And they're one of, surprisingly enough, one of Vermont's largest trading partners,
Okay.
foreign trading
Yeah.
partners because of the semiconductor business.
Right.
I will say, we had lunch with.
Just a minute, I've got it right here.
Great. I'll take a picture of that, please. And
Do you like my filings?
I do.
at one point, half the ministers in the Taiwanese administration were from Purdue. So I
Well,
a lot of these things, the civil
We had lunch the other day with the representative from the Boston office.
Right.
And while we were there were 3 students from Taiwan
Okay.
that were at the table right beside it and came over
At Norwich.
at
Yeah.
Norwich, and they were all,
Yeah.
they were specifically military.
Okay, yeah.
And
No, we'd love to.
he's the director general.
Yeah.
Wellington is
Yep.
the,
Education.
well, no, he's like the state liaison for Vermont out of the Boston office, but, I think he called himself Charlie, but Charles, I have a hard time
Yeah.
calling the director general Charlie. And so, it might be worth
We'll follow.
We'll follow up. We've also hired an executive director for international programs and partnerships, who's very good and experienced.
So, well,
Or
then-
just work with the Big Ten, so we'll connect that way, but if, I would particularly of all the countries we could be working with, I mean, Taiwan is a very strategic choice, and we would love to do that, so. And other countries too, we're growing our international study abroad sites and all that, so I think you'll hear more about that in time. But speaking of, I guess what I wanted to convey was how, while we're focused on UVM being the best partner it can be for the state, we have increasing national renown. And so in terms of the partnership with the state, you all know we have these horrible floods and we have the spatial analysis lab, which, all right, so I visited the Maza farm with the governor, with Secretary Tevitz and Senator Welch and others, and our drone team came along. And they took, they mapped all the damage, and farmers were so sort of shell shocked, so, not prepared, that they weren't ready to even file the federal disaster relief reports and such. So these drone team folks helped them do that, and that got the disaster relief declaration. So the spatial analysis lab has been an amazing asset. Has 60 or so undergrad students, some staff. Unfortunately, we lost their leader, Jawad Dunn, who passed away just unexpectedly. But we will do all we can to support that effort. So that's a direct example of something that's so helpful to the state, right? And then there's the Leahy Institute for Rural Partnerships, which we kicked off, we inaugurated in the fall. Named it for Senator Leahy. I've gone to him, but over a year ago, and my point to him was that none of these fancy schools, the MITs and Princetons and Stanfords, think about rural issues. Vermont's all rural, so we need to figure out how to better support folks in the 14 counties we've got. They don't have the resources, they may have great ideas, but not the resources to get their ideas to fruition. So can we get them grants to do it? Can we get them the technical expertise to do it? So we'll be announcing grants to folks in all 14 counties very soon now. Tricia Coates is director of that institute. You all know Tricia from her service with Senator Leahy and Senator Welch. So that's a great effort that's taken off very nicely. It kind of complements what we started with the Office of Engagement that you all supported early on, and of course the UVM extension. And just a couple days ago, Vermont Public had a nice story on them. Maybe you heard about Kelly Hanshaw, one of our faculty members who helps mobile home people who were affected by that, mobile home folks in the flooding. And that was really nicely done. The Hetchinger report did a nice long piece on them. So it's being recognized as a model for how a public flagship can engage with its community, with its rural communities. So happy to send you that link if that's of interest.
Senator Lyons, are you putting your hand up?
Yeah, I am. So I'm pleased to hear you talk about that. I did not hear the article, but having grants available. I'm talking to some of the small producers,
Yes.
Agricultural producers who were very badly affected by the frost in May. And nothing available for them, but I'm thinking that what kinds of grants, where could they find a grant that would help them identify prevention for when the frost is predicted? Well, they have it in Florida, but we don't have it in Vermont, right? Because we're used to our own weather trees. But so I'm glad to hear that. Maybe there's a way to send the message, get the grant out to help the little guys to prevent the frost damage next time. I don't know if you can do it with a whole orchard. Maybe you can spray them and keep them when they're blossoming.
It's really more where we're seeking innovative ideas from the community.
Yeah.
But they don't know how to take the next step. So we can support their
Sure.
practicing that, whether it be healthcare delivery or transportation solutions, or municipal governments have suggestions. So please connect them to Tricia Coates or to Wendy, and we don't want to tell them what to do. Of course, we do that all the time, but we want their ideas and we want to support them in maybe they have a great idea and we can help them file for a patent or make a business out of it and all of that sort of stuff. So it's a very new way of assisting our community, and I'm hoping that it will stand as a model for the country as to how rural, because every state's rural. Indiana's rural, California's rural.
Every state. right?
Yeah,
And
so.
frankly, except for probably Metropolitan Burlington, this whole state.
Yeah, exactly.
Even,
So,
one of the things that we have done, in terms of trying to, our continuation rate of high school graduates is dismal.
yes,
It's nothing to be, proud of, to be honest. And not that you need to have a 4-year degree, but one of the things that we have tried to think about is how do we make college more affordable?
Yeah.
And certainly the senior year that students can take their
Sure.
senior of high school in 1 year, and the other was CCV courses, which is, you have indicated is a very direct pathway to
Yes,
university.
yes.
And I was just wondering if we make investments here, and the question begins, obviously, what has been the impact? I wondered if maybe it's too early to tell, but I was just wondering what you're experiencing in terms of the Vermonters. That's a very affordable pathway to get a 4-year degree with 2 years already. And some kids can actually graduate from high school with 2 years of college for free. I mean, so I think we tend to forget some of those,
Right.
we only focused on the direct appropriations, but there are a number of ways in which we've been trying to. I'm talking about direct appropriations, either the state college or to the University of Vermont, but how we've tried to encourage our high school students to really pursue higher education.
Yeah, the enrollment management directors for UVM, but also for Vermont State Colleges and for CCV, all came together and testified to several committees. They're working very closely together with the goal of getting more high school students in Vermont to go on to college, doesn't matter where. So that was well appreciated, I understand, and we continue to work on that. To your point, we had 9 programs that caused pathways from CCV to UVM. When I came here, now every program has a pathway, right? So you can take 1 or 2 years at CCV and come on to UVM. And those students who do that transfer have a much higher graduation rate and retention rate, and they are far more successful. It's a very good success story that those kids are actually performing better because it more motivated and you think of various ways.
Do they have to go through the regular application process, or is there a different process if they've done 2 years at the community
It's a
college or
pretty
state college?
straightforward pathway. If they meet a certain GPA, they get in.
So it's called an articulation agreement. And CCV will set out a series of courses that are prerequisites that they must take successfully in order to transfer to UVM. But as long as they take that prescribed coursework at the prescribed GPA level, they are automatically transferred.
Is it just CCV or the state colleges?
So
the
we have
University
some
College of Vermont or whatever we're calling it.
with some with Vermont Technical, we have some. But Joyce Judy has been the one that's been most embedded. I had lunch with Beth Mauk, the new chancellor of the system, and mentioned all this to her. She's early days, but I said we'll be happy to collaborate in any way. And
So that
so
seems to be the weak link in our higher education system and with all the strength of the university. And I think CCV is doing a great job that any way that I could help pull them along would be great.
and I offered her my complete support and said, look, we're not competing. We're not competing for dollars, we're not competing for students, we're not competing in areas. So she has some very good ideas about focusing on certificates and 2-year things, etc. I think she's thinking in the right way, and I've offered to help her as a sounding board, as a partner in any way she does. So
One of the, and I think we've talked about this before, has been suggested. And that is, if you have applicants from other states and maybe they're good students, but you can't admit, if you've got 30,000 applicants, whether there could be some kind of an automatic referral to the state college system for possible consideration if they want to go to school here in Vermont. And I gather some schools, some states do that, but maybe it's under a more unified system than we have here in Vermont.
yeah, I mean, there are challenges to that, but I mean, it's certainly
Obviously something you have to discuss.
Sure.
Later.
Yeah. So, I feel like what we hoped to do when I came here, I think it's come a long way and we feel very embedded in the communities and the tuition freezes and all that helped really well. A few other things I hope that we can all work on. One of them is cancer. I know we're digressing, but Vermont has about 150% of the median in other states of cancer occurrence, with more cancer here than other states. And there's no reason we should, other than the fact that the rural communities don't seem to access medical care as early as they should. And so, we have a cancer institute and it's a cancer center. It's been doing well, but what we need to do is to go to the next step now and get an NCI designation. The National Cancer Institute has a designation. If you can get that designation, more money flows through, but it's also the profile is raised and all that. And what that means is that we have a certain amount of expertise, certain amount of research, certain amount of philanthropic funding, which we're working on, but they also insist very much on some state support. I mean, there are states that have put 100 million towards cancer centers and stuff to get the NCI designation. We don't have that capacity here, but I talked to the governor's office about even a sort of a token support would be helpful So I suggested, for example, if we could put in 5 million a year for 5 years or something like that. Not some base budget increases or something, but a one-time thing for a few years. That will be viewed very well by the NCI. And if it's not 5 and you can find a little less in your drawer, and so be it. But I think that if we could support the cancer center we're calling it the Vermont Cancer Initiative. We did up a 2-pager on it and shared with the governor. He was very interested in it. His staff were very interested. We can have, the cancer center director come and speak with y'all, or the health committee, et cetera, Rick Page, the dean. So that's something you might consider. We've done a lot in other spaces, but for the cancer center designation, some support from the state is critical. So I thought I'd just kind of see that as you're looking for ways to, just to address this dread problem across Vermont that we're all familiar with.
I mean, one of the things that we have is certainly the coverage of Vermonters is very high compared to other states. So raises the question, and then we have statewide FQHC presence, which is really early detection and screening is so important. It raises the question about protocols and just people accessing those kind of early services.
These folks want to sort of hire a few people, 3 or 4 people to go across the state, push the, treatment, if you will, gather data, the clinical stuff, do the research, et cetera. So there's some good plans they have. And so if you're interested, we can certainly share more with you.
Makes you wonder environmental if there's something at work here.
There's a lot.
I know, but it's something unique to Vermont because a lot of those environmental risks are.
Well, Senator Starr's working on that.
2 mornings.
Yeah, I know.
It was.
And then there's, speaking of health, there's our Osher Center for Integrative Health. I mean, the Osher Centers are very special things that exist at Harvard and University of California, San Francisco and such, but they chose us to provide a grant to set up an Osher Center for Integrative Health because they found what we do at UVM to be very unique and different in terms of a wellness-centered approach, an interprofessional approach, bringing nurses, medical folks, education and social services and all that. So the Osher Center is doing really well. That's another example of our national prominence. We're hosting the Osher Collaborative Conference at UVM in
They do
October.
seminars too. Dartmouth does a lot of OSHA.
There's learning. Ollie is a Osher there's the first child is something lifelong learning. Yeah, they do that. This is actually a research center that and then there's the Food Systems Research Center. Of course, it was the first in 3 decades. It was the first center that ever started again with Senator Lee's help. That looks at small scale sustainable food systems and farming. That's so appropriate for
Like my garden.
Yeah, they do. Absolutely. The really hot peppers. So
I do have hot peppers.
and that could be a model for many countries, for other parts of the state, of the country, et cetera. But we get a lot of national attention for that.
What about one thing that we have, and I read you have your quarterly that comes out that for the School of Medicine, College of Medicine. And a couple of editions ago, and I wish I had saved it. It was an article that really struck me, and it was about the higher ed consultant, Abraham Flexner, who consulted with colleges around the country. And he was recommending states, our universities to close their medical schools. And Vermont rejected that recommendation. Bowdoin accepted it and shut down their medical college. Dartmouth accepted it and did like a 2-year pre-med, then you had to transfer out. So they didn't have medical MD degree program until back into the 70s, but it was a 60-year hiatus. And many of the colleges of medicine that got shut down actually educated physicians of minority populations. And so part of when you sit here, it raises the question about what do we sometimes do for short-term financial expediency, and what are those long-term, and another areas like nursing, tremendous shortage. our hospitals used to have nursing programs, and they grew their own workforce, and many wonderful RNs were trained, but then we went to the more academic
Yeah,
model,
yeah.
and it constrained the supply, and so here we are, and it's sort of like, how do we learn those, or apply those lessons?
I was gonna
today.
ask, I was gonna ask the question about nursing, because we have a proposal in our committee for nurse apprenticeships. So a clinical, engagement for nurses who are in the middle of their studies and not ready, but actually beginning practice, so.
Yeah.
But what is, if anything, happening with trying to expand the nursing program? And I understand the barriers related to faculty availability. Now we have
Actually,
remote,
practical of it,
we have remote, I don't know, but of
it's really the practical training the nurses need, and we don't have enough slots for it.
course.
That's what, we doubled our nursing numbers, not so long ago. The number of students in our nursing school, to grow it beyond that, they all need rotations, right? And we're not finding enough placements for them, so that is the challenge there. But Senator Bishop, to your point, it is precisely that, right? Are we looking around the corner and thinking about the future? And that's where I think the cancer center thing fits in. I mean, this thing is not going well, and if you want to address it, all of us have experienced it. Somebody or the other in our families has it. I think a little bit of investment at this point, especially not like base budget stuff, could help us get ahead of this problem. And our cancer initiative has some very good ideas, practical ideas of how we could probably get the numbers down. I think you can hold them to it, I think. So I'd like to, have us think about that. Another institute that we started this fall was the Institute of Agroecology. These are all ground up things, right? It's the only land grant university in the country that has an agroecology center. And agroecology is a very interesting way to look at things. It's the science of climate change while talking to farmers and getting their wisdom and marrying these things and figuring out how
But
best
we
to.
do know our growing season
Yeah.
is longer,
Exactly.
a lot longer.
And how do we sort of live in harmony with our, environment, with farming is the question, and there's so much interest in that. The McKnight Foundation, various other foundations were excited to see that happening at a land grant, and so you'll hear more about that. These are all things that are in the land space. Then there's the tech hub, right? You all know that the US Department of Commerce had a competition, 400 applications went in for a tech hub designation. We were one of 30 that got it. And so this is gallium nitride technology, so advanced chips. Speaking of Taiwan, that's another interest. And we collaborate with global foundries. It's a way to keep them in town and not think about other things and grow and expand here. Imagine out of the blue, if we succeed, we'll get 75 million or so towards that. And it'll be a sort of a closed loop design industry that we will have right here in Vermont. And there's a lot of excitement around it. We're partnering with the state colleges on that. We're partnering with, the Department of Commerce and so on. So Tech Hub is a new thing. So suddenly, like UVM is being talked about across the country, saying, "Oh, you're doing gallium nitride stuff." So that's a great win. We're looking at a bio incubator. You've all heard about the Hula and things like that, but they don't have wet lab space and BSL space and so on. So we're considering whether it makes sense for us to house a bio incubator to just set up companies and such. So these are all things that are growing UVM's national presence, and that's part of the reason we get as many faculty applications, administrative applications, student applications, et cetera, as we do. And so we doubled in research funding in the last 4 years. Research funding does not add to our base. We put more money towards research than we bring in. It's always a loss leader, but the great work we can do with that and the sort of preeminence that comes from it is huge. So now that money, that amount is not that far off from what Tufts brings in, what Rice brings in, what Brown, it's more than what Brown brings in, the more than, not far from what Notre Dame brings in. So when you think of these, mid-sized private schools, you think of them as these elite institutions. well, we're doing about the same here. While being a public land grant distribution. So it's a mindset change, even among our faculty, so I guess I want you all to be proud of what UVM is becoming or has become. And that's a message to you, that's a celebration, really. I'm not coming to you with, to solve our issues. But
Because I've got a few that I need help with.
The one ask we put in with the governor's office was, he included in his budget, as you probably know, the 3% increase for us this year in our base. And that's a good thing. As you know, for 14 years, we had no change in our base appropriation. With your help, it went up a couple of years ago, and then we had 3% last year and 3% this year. It's just a question of just gently having the discipline of having some inflation adjustment kind of thing, because our costs certainly are not going down. No, health insurance is our biggest, yours too, everybody's. It's a true gut punch. Our costs exceeded, health insurance costs added $14 million to our budget last year, and it's looking even worse. So that's something you can't cut and you can't do this and that or strategize and make go away. It's just there. You gotta pay it. UVM covers 84% of that cost. Our employees only pick up about 15-16%. So that's a huge deal. So of course we are dealing with it. We will continue to deal with it. But we hope you'll support the 3%. And anything you think, if you want to think more about the Cancer Institute, the Vermont Cancer Initiative, that's the one thing I would say, that even somewhat modest support from the state will be well received by the by.
You're fortunate because a lot of core services receive no increase, and it's flat.
Yeah.
A lot of, like our youth service programs, our mental health delivery system, so. It may not feel any better, but if you could have had deja vu all over again.
Yeah.
What the governor's budget provided, so.
We're very pleased that he did, and we know you're great supporters, including our patriot over there on the screen. So thank you, but we hope you will support that, and feel free to, mystery free to be 4 or 5.
If we have any questions, we have Wendy's number.
You do indeed, yes.
She knows that.
And I will come back anytime too.
What time do you have to be in education?
2:30.
2:30. Just didn't want to make sure we're late. Yes, Bobby.
Yeah, I was wondering, have you ever tracked why your healthcare cost is gone through the roof? Because I never went to the doctors much, but as you get older, you go more often. And I don't know if it's normal, but it seems like you go to your primary doctor first. But then they send you to another doctor. So you go to that doctor. And by golly, they'll send you to the third one in many cases, or to therapy. So instead of going to your doc and getting treated, you're hitting 3 or 4 others in that same circle. Well, everybody has to be paid, and that, my philosophy is the reason health insurance is going through the roof is because you don't go just see one doctor, you have to go see 2 or 3. So, and I don't know if, that's just my
I
own
don't
theory.
Well, most primary care, and this gets back to the cancer issue. And most primary care docs are not in the business of oncology treatment. So a lot depends on the nature of people's condition. And I guess, that's kind of an interesting statistic about our cancer, the prevalence.
Yeah.
Here in Vermont relative to other states. And we also know we have a higher suicide rate, but so do all the northern tier states, which raises the question about, is it lack of, and we haven't had any sunshine for, for.
We're
No,
gonna
they
get it
said,
next week.
they said in
get
January, we
sunshine
had
next
21 days of cloud.
We're gonna get an hour tomorrow.
We got an hour,
Okay,
okay.
good.
We had a
But we should send the 2-pager, some version of
Yeah, I
that to
will
the
do.
committees we're talking to today.
On what, shortness of life?
The cancer.
No, the
Cancer
cancer.
Center, let me just say that one of my goals is to have, the head of the Cancer Center come into my committee and help.
Great.
Welfare.
Okay, good.
Yeah, so
good,
I'd
yeah.
love to do that.
Randy's
So
wonderful.
Wendy will, and Jason.
I already
Williams.
reached out to your committee
Yeah,
assistant. about
good,
it, so-
very good.
Reach out to her, direct. She wants you. Good.
Yeah.
So we'll do that. I don't want to abundantly get, I'm not an expert on the question you asked. I think primary care doctors, I value because they keep your entire health in mind. And, you know, think about whether your metformin is interfering with your whatever else and so on and so forth. So I think one person thinking of all your care is helpful. I think there are many, many, many reasons why health insurance is going up. The health insurance companies have a lot to do with it. It's not just medical hospitals.
You're self-insured up here.
Sorry,
UVM self-insured.
we're self-insured, so any hits come to us directly.
You probably have to stop.
We were looking at all kinds of things, like 2 years ago, we renegotiated our prescription drug benefit, and we saved about $7 or $8 million without changing any benefits. So we're talking to the health
Oh, I
network,
want
to
to
see if
stay
we
one
can.
formulary, Jimmy.
We're good, we're gonna have a prescription drug advisory board.
Go, oh, well.
We're working with the health network too.
You get another advice for that.
Hopefully something.
No, we're gonna get it.
Yes.
It's, and not only.
Canadian drug? Are you gonna allow them to buy Canadian drug?
We already got that going, and we gotta make it happen, yes.
We should have a bunch of food trucks on both sides with drugs and just.
Pharmaceuticals.
Pharmaceutical.
Right, but what can I help you understand about UVM? I'm pleased to be here and to share good news about UVM, really, but I'm happy to answer any questions, whatever they are.
Those are real good numbers.
Other questions or comments?
Terrific. My niece and nephews love being at UVM.
Really?
I have a niece there now.
Oh, that's nice.
She's doing well.
Thanks.
She loves it.
Yeah, and we send you legislative interns. I just met with some upstairs.
Well,
They seem happy.
Yeah, we've had one in transportation.
yeah, she's really not ours, but she likes coming to the
Right.
committee. But I think, Senate committees tend to perhaps be a little more,
This committee is
Free
more
floating.
fun.
what, this committee?
It's fun, funner than most others. So
That's what we've heard.
and then you make all the food and stuff. So
I know, I have cookies too.
yeah, but that
Short
thing was
bread.
good, whatever that was.
What?
Oh, the fruitcake.
Oh, the fruitcake.
I saw him eat it all. But
I couldn't,
Did he share?
no, I wasn't gonna cookie.
I could see you eyeing.
I'd rather have the 3% than a bit of fat.
Oh, all right. Any other questions for the president? Otherwise, we can give you a little time.
Well, I was gonna give just a,
Good.
Oh, sorry, Senator Sears.
Yes, sir.
well, I was gonna ask about football, but at UVM, but I guess
Yeah,
my
I'll be
annual
meeting tomorrow.
question.
As Tim Ash says, they've been undefeated since
Right.
1972, I think. So,
Yes, I believe that's correct. I
uh,
did want to comment on the healthcare, though. In discussions at Southwest Vermont Medical Center, we're doing our best to get the cancer center back up and running there. And hopefully there's no confusion about which cancer center, since ours is called the cancer center as well. But I wanted to comment on Bobby's comment about healthcare and costs. And the president mentioned insurance. And in talking with hospital leaders, and it's something I think we all should be aware of and take a look at, is the rising number of refusals of
Yes.
insurers to cover certain procedures that occur and how that's impacting future healthcare costs. So when an insurer refuses to cover some procedure that a doctor has recommended, it can lead to more serious complications for the patient, which then obviously drives up the cost. And so I think it's something that Southwest Vermont Medical Center anyway is seeing at a much higher rate than ever before. And I don't know where the UVM Medical Center is seeing the same thing, but as we talk more and more about this problem, I do need to mention that because it's really a serious concern.
Senator Sears, I want to reassure you that both the House and the Senate have provisions in legislation that are dealing with prior authorization, which is what you're talking about. And so we're working on that, and we've had great testimony from UVM on
Oh,
that.
good. Well, I'm glad you named it prior authorization because it escaped me, and
Yeah.
No, that,
there's a technical term for everything. But
Yeah, there is.
yeah, no,
Permission to practice.
that was, part of why the state employees were so concerned about a shift to, Medicare savings,
Yeah.
away from, what we had.
One of the challenges is insurance companies stop operating in states if they, are too tough, and then our choice decreases even more, but, good to hear from you, Senator Sears. I wish you were here in person, but I wish you well, and I hope you get better soon.
well, I'll be back on Tuesday. I think
Yeah, we're counting on it, Dick.
I'll be back to cause trouble in person.
I miss you, you're right here, Dick.
You're
Um,
holding up the supplemental budget. We need you here.
I
So.
think there's more than me holding that thing up.
I think you might be right. Any other comments or questions? Otherwise, thank you. 2:15.
Thank you.
2:30 on a Friday afternoon. They've got you scheduled.
Yes. Always happy to come, so,
Thank you very much.
thank you very much for all you do. It's tough to manage all the.
How are you?
Hear much anything?
Emily.
Yeah.
Oh, and two.
I know the new persons.
Which items?
I like to.
Oh, thank you. Uh-huh.
Yeah.
Bye, Wendy. All right. How's your new puppy?
He was very, very sick
Oh,
yesterday and it was really scary. We had to go to the vet, but he's feeling better today. And keeping us up.
What kind of a,
He's a yellow lab and he's 4 months old. His name is Patrick and he's really cute. And it's good that he's cute because otherwise he might not be alive. Bye, everybody.
Emily will be over.
sick?
So why don't we just take a brief break, and the what Senator Westman and I were talking about is getting a better understanding of the match that we need to have to draw down the federal FEMA dollars, what that looks like relative to what is in the House. We have the obviously that 10 million that the House put in to provide support to the communities that experienced so much damage. That's a different issue, to some extent in terms of how we want that money to go out. But we need to make sure that we understand fully what it's gonna take to draw down those federal dollars and how that construct works. And that ties into the 5 million we were talking about yesterday, so.
What was confusing to me is we have the 10, we have the 5, and then we need to make the match with a 37 or 38 over here, and
And that was too many 5 millions to pay pots.
and the terms, for me, the other thing is what exactly are we covering for costs, in that?
And so Emily will come in shortly, so
That's what she's gonna talk about.
yeah, so what I'm gonna do is go offline.